Welcome in, everybody. I'm Dr. Marianne Pinkston. This is The Better Life with Dr. Pinkston, and I am bringing you another fantastic episode. This one I am extremely positive about and very excited about. I've had Dr. Jill Carnahan on before, but she is joining me again. Thankfully, I'm always honored to have you on. Thank you, Dr. Carnahan. But you're practicing a little bit up in Boulder still. Got a great practice, thriving practice going, but you also have a huge amount of work on the side. You've got a great book, Unexpected, which we talked about previously, and it's on my website for everybody to look and buy. But podcasts, newsletters, blogs, you speak. What do you not do? How do you find any time for yourself these days?
Oh, you're so sweet. Well, you know what I realized long ago, because I was like an introvert and I thought the stage was so scary. But I realized when we were passionate, and I know you're the same way about what we're doing. And for me, it's teaching and inspiring. So when I get that bug of like, okay, if there's an opportunity to teach or inspire, I have all the energy I need somehow.
Take it, and it's we're so glad you do. You bring a lot of fantastic information to people. People are looking for answers these days outside of their contemporary, medicine circles now, and I'm so glad that they are. And it's actually kind of kosher now. We're actually okay to speak out more lately.
Oh, finally, I know. It's about time, huh?
Thank goodness for that. But what I really wanted to have you on for today is to describe something that I think many people have but do not know about. Certainly their physicians do not know about. And that is mast cell activation syndrome. So it's called Mast. And so tell us, if you don't mind, tell us
Sure.
a little bit about what it is and how we look for it and how people know they might have it, and start us from there.
You got it. So mast cell activation. Let's go back to med school though, because what we were taught in med school was this thing called mastocytosis. So mast cells, first of all, what are they? Mast cells are these primordial cells that are kind of our defenders. They're very early in our immune system. They're not very differentiated, and they protect us from environmental insults. And it makes sense that they would be activated by environmental insults. And it also makes sense that we're having more and more issues with our mast cells and with people with mast cell activation because now there's so many environmental toxins and infections and triggers for our mast cells to be activated by. But back to med school, there's this thing called mastocytosis, and it was more of a proliferative disorder, meaning like the bone marrow actually caused overgrowth of too many mast cells. And that was the main thing we were taught in med school, this mastocytosis. It's almost like a precancerous condition where you just have proliferation of a bone marrow part of the immune system. And so we as physicians weren't very good at looking for other types of mast cell disorders. And then what happened is we've had masses of toxic exposure. I deal with mold toxicity a lot, and that is a big trigger for patients. And then infections like the pandemic and other viral infections, and all these things are kind of building up to create a epidemic of people who don't know they have mast cell activation disorder. And the truth is that is the core thing behind so much of what we see.
Absolutely. So absolutely, and that's why I kind of wanted to bring it to the top of our talk today, because I think many of the symptoms that people have, they confuse, and we go to the internet now, or I say we, patients go to the internet now, Chat GPT, they try to find their diagnosis, Facebook, wherever, to the social factor, but there's so many confusing symptoms that people can have and confuse it with something else. So what are the main symptoms of mast cell?
Yes, so this might surprise you, but the number one symptom is subjective cognitive complaints. So, for example, my memory isn't what it used to be, or this ambiguous title we call brain fog, which what does that really mean? But when you say it, a patient knows what you mean. Anyone who's been menopausal knows what you mean. So that brain fog is just kind of things aren't as clear and sharp. Maybe your executive function with your planning, your list making, your execution of what you want to do in the day, you feel more foggy. You're like wandering around and not getting things done as efficient as you're used to. Or if you just have a thought and you follow through, that's clear thinking. And this brain fog is real common. Now, other things, our skin is an organ and our gut is an organ that has a ton of mast cells. So two things we see a lot of are things like gastritis or heartburn or leaky gut getting worse. All of a sudden, you're really sensitive to way more foods than you ever were sensitive to. Rashes, skin lesions, even acne or other types of autoimmune skin manifestations are common. And then the heart has a lot of mast cell receptors, surprisingly, so we can get increase in heart rate, like tachycardia, palpitations, irregular heart rate, or even heart chest pain that's not cardiac. So many, many things, many systems. And really, if we look at some of the papers on mast cell activation, there's even associations with endometriosis, with pain syndromes, chronic pain syndromes, and this whole slew of mental health issues like chronic anxiety, insomnia, depression, even suicidality has been linked to mast cell disorder. So it's such a wide range of symptoms that people could have. And as you can imagine, if you're listening, you're like, oh, well, I had that one or that one. Could it be mast cells? That's a common question.
Absolutely. And so if somebody, I know there's so many things, so estrogen dominance, and you mentioned menopause and hormone deficiencies, there's so many things, insulin resistance, MTHFR, all of these issues are, gathered around trying to make us feel extraordinarily sick, but we try to nail it to one thing. So I know patients will come in and say, I have all these symptoms, I have a thyroid disorder. I'm like, you have a lot more than that, as we do, labs and try to pull that apart. So I caution people, to try to categorize themselves into that one category of one illness, because there's so many things that can occur. So you mentioned things like the hormonal dysfunction, the acne, endometriosis, and things like that. So how does that tie into the hormones?
Yeah. So my view of the world is quite simplistic, because when you think about these big paradigms, and I'll explain it, it's way easier to frame everything. So functional medicine is obviously what you and I do, and integrative medicine, and root cause is really at the core, saying, okay, what mechanistically, biologically is going wrong in the body to create this set of symptoms? And that's what you're getting at, or what patients are trying to figure out with their doctor. But the interesting thing is, I always say almost all of what I do with the complex chronic illnesses, the autoimmune disease, the cancers, the metabolic syndromes, the mast cell activation disorders, all of these very frequently are contributed to by toxic load on one side and infectious burden on the other. And this is like under the hood of the car, where many conventional doctors aren't really looking for the root cause, because they've never been taught. I wasn't taught in medical school to keep saying why. Why did that happen? What happened? But as a detective now, that's my number one question. So when I say why, often I find that some sort of toxic load, that could be the air quality, like nanoparticulate from the fires, wildfires. It could be mold in your home. It could be metals in your air, or in the burning products, from wildfires, or in the, amalgams in your mouth, or whatever issues there. Then there's parabens and phthalates in our perfumes and our makeup and our bath and body products. And there's VOCs, which are from off-gassing from our new cabinets, or our new flooring, or our brand new home. And I could go on and on and on. And there's things like persistent organic pollutants, which are organophosphates and things that are sprayed on crops, still real commonly used in the US, things like atrazine and glyphosate. And all of this contributes to this toxic load. And that is one of the main triggers of chronic dysfunction of immune system, including the mast cells. Then on this other side, we have infectious burden. So we all know, most of us, about 95% of us above the age of 20, have had mono in college or in high school. Mono is Epstein-Barr, and it's a real common virus. And if you think about the examples of chickenpox, when you're a kid, you get chickenpox, and you don't ever see that happen again until maybe you're 75, you're stressed, you're at the surgery, and you get shingles, right? That virus was dormant in your body all those many decades. And Epstein-Barr, CMV, HSV, Lyme disease, tick-borne infections, all of these many infections that we could have been exposed to as a child or as a teenager. If our immune system is robust, it keeps them dormant, it keeps them at bay. But when we get under stress, we aren't sleeping, we get a flu, we get COVID, we get sick, whatever is happening, or get surgical intervention, then all of a sudden our immune system starts to weaken and these old infections pop up. And so it's this interplay between environmental toxic load and infectious diseases that is the number one thing that creates immune dysfunction and inflammation. And in that bucket, primary, so frequently happening now, is mast cell activation disorder.
Absolutely. And so with that, the toxic load, it's very overwhelming. I even heard something the other day. So we live in I live in South Texas, right? Where, you in the summertime, you get into the car, the car registers 120, 130 degrees. Well, all the plastics in the car, you get in and you are inundated with that, new car smell or whatever smell you've got in there. But those are like, BPA, all those environmental toxins or whatnot. You're breathing it in there until the car cools down. We don't realize just how surrounded that we are here in the U.S. This is not always necessarily the case overseas, but we allow a lot of things in the U.S. Our government allows a lot of things that do surround us from a toxic overload. It's everywhere. I think people get really overwhelmed with trying to pick and choose what they need to do to stay healthy. Do you have kind of a top maybe 5 things that you would do to maybe not overwhelm yourself, but start changing your toxic world around you?
Yeah, I love your frame because years ago I learned from Dr. Bob Roundtree. He was one of the king of functional medicine and taught about environmental toxicity. And I remember coming out of the lecture, he was funny and entertaining and a great lecturer, but I was like depressed because environmental toxicity, if you don't have solutions, is really, really overwhelming. I always say it's like we're swimming in toxic soup. And all of us have to think about toxic load. Otherwise, we are behind the game and we're going to get sick. It's inevitable. So that part's kind of depressing. But I love saying things that are very simple to put into place and that don't take a lot of resources or money or an expensive consult with a doctor like me or whatever. You don't need that. You can start on your own. And so some of the things I like to start with are clean air, clean water, clean food, clean mind and body. And I can tell you about each one of those, but you can kind of remember them easily. Clean air, one of the things we don't realize is about 80% of our environmental toxic load is from the air that we breathe. So that's a really big deal. And if you are not thinking about air filtration in your home and your workplace and maybe even your car, once again, you're getting these nanoparticulates from exhaust, from the off gassing of your home, from formaldehyde, from just all kinds of things. Even just cabinets nowadays and flooring nowadays is so toxic. So if you get new materials in your home,
Right? Our laundry, like your little
yeah,
laundry fabric softeners that you put in the dryer sheets and things like that. Yeah, everywhere.
yeah, this all adds to the indoor air that we breathe. And because our homes now are so efficient, so even LEED certified buildings are, the pride there is that they're so efficient. Well, efficiency leads to lack of airflow exchange if we're not careful. And some of the most toxic homes are the most efficient because they're not, it's almost like if you had an old log cabin from the 1920s, you'd be better off than you would with a modern LEED certified building because there's just airflow through the cracks in that building. And you never, when I talk about air quality, we think about dilution is the solution to pollution. So if you have outdoor air coming through the windows or you have air exchange at a high frequency rate, in fact, in the hospital labs that have the really efficient sterile environments, all they do is exchange air at a more fast rate, a rapid rate. So that's it. So one thing you can do for air filtration, get a high MERV rating in the furnace filter in your home, in your HVAC system. Make sure you open the windows when the air outside is clean and clear and get some of that air exchange when possible. And then make sure you have a standalone filter. I have one in my bedroom. I have one in my living room. I have 5 at my office. And you want something with a HEPA filtrate, which is a particulate, but also a filter that filters out VOCs. Those are those volatile organic compounds like the smell, the smoke, the formaldehyde, the mycotoxins, and even virus particles, those 2.5 microns and below. So that's clean air. Clean water, you're not drinking out of plastic water bottles, you're drinking filtered water. And nowadays we need filtration, whether it's a fridge container, yeah, exactly, or whether it's a standalone. There's Berkey filters, there's the fridge filters, there's a whole house filter. All of them are good, and all of them to some extent will filter. Some are better than others, but some sort of filtration system. Don't drink tap water. Even in our local community here after the fires, they regularly put out reports showed super toxic levels of contaminants, and they didn't even tell the public. It was just people were getting sick, and that's the regular city water. So you can't count on the municipalities to filter your water like you would at home. And even
Deniers. So fluoride, right, is also a concern. So yeah, absolutely.
yeah, I think so. And here in Colorado, and I'm sure it's common in Texas and everywhere else too, PFAOs, polyfluorinated compounds, have been dumped into the water supplies. These are forever chemicals. They're like Teflon and Gore-Tex. They're not going away, and they've been found in Colorado in all of our water supplies. So we have to filter our water. That's clean air, clean water, clean food, making sure you're eating local if possible, organic whenever possible, non-GMO, ideally from a farmer where you've actually made a relationship with that farmer, gotten the fresh produce if possible. I'd rather have someone get local fresh produce that's not certified organic than to ship, blueberries from California for 3 days in a truck that's organic. So those are just some of the basics there. And everybody has access to at least some of that without spending a ton of extra money.
Correct. And what do you think about ewg.org? Do you have kind of a site or an app or something? Because there are places where you can go and look up your products and look up simple things that you can do. What do you think about that?
Yeah, so there's so many apps now. My two favorites, one is Skin Deep, and that's the environmental working group. The one you mentioned, it's called Skin Deep, and it's an app, or you can go to ewg.org. The other one's called Think Dirty. It's kind of a cute name that you remember, and it's about looking. So you could literally be in the Sephora or Ulta store or whatever and scan a product right on your phone, and it'll give you a rating of if there's toxic chemicals and if you should use that shampoo versus something more clean.
Right, right. And nothing is perfect. We will never be perfect. There's no way to get there. It's just doing kind of those top things, I think, is really, really focusing hard on your health and on your life. So back to mast cell. Do you believe that this is something, and I do believe that this is something underlying long COVID, people who have long COVID?
Yes. Okay. So I'll frame that because I think this is so fascinating as I've learned kind of what's happening with long COVID. First of all, back to the mast cell, we established these primordial cells that get activated. They throw out their tons of literally hundreds of chemicals, including prostaglandins, which increase pain, and histamine, which increases the rashes and the heartburn and all those kinds of symptoms. So that's real common. And they are triggered, like we said, by toxin and by infection. And that's why, particularly post COVID, it was an infection that was a very big trigger to many people's mast cells. Now, what we're seeing is these things, I call it the triad, and I'm not the first one to speak about this, but there's lots of things that go along with that because post COVID, we have a lot of endothelial damage. And that's one of the reasons the mast cells get activated is the endothelium is particularly damaged by COVID. And so that regulates blood pressure, it regulates all the blood vessels in our body, and it actually secretes mast cells and the symptoms. So frequently with the mast cell activation, we'll see people with POTS, which is postural orthostatic tachycardia. They tend to lay down, feel fine, they stand up and their blood pressure drops and their heart rate goes up. And the reason for that is because our cardiac output is determined by two variables. One is stroke volume and one is heart rate. So if we're not getting return of the blood flow because the endothelium isn't contracting like it should be in our periphery, pushing that blood flow back to the heart has one way to compensate, and that's by increasing heart rate. So we often see this, they stand up and the heart rate goes 20 beats per minute higher than their baseline. So say it's 60 when they're lying down and all of a sudden they get up, it's 120. That's POTS. And there's this other thing called dysautonomia, which goes with this, where the autonomic things, our breath rate, our oxygenation, our blood pressure, all of those things are, even our temperature should be regulated. And post-COVID, a lot of times people will have dysautonomia, which is related to mast cell activation. And they'll have trouble with regulating blood pressure or even their temperature being cold or hot or their circulation. So those things are real common and kind of hang in circles. And again, it's because this infection of COVID particularly damages some of the places where the mast cells are, which is the endothelium.
Absolutely. And that goes back to your point about toxic overload versus infectious overload. And so there are, exposures. And so there you go.
Mm-hmm.
I think, we talk about allergies. So you get, you get hives, you get itchy, watery eyes, runny nose. A lot of that is within just things in the environment, pollens in the environment or certain foods that we eat, lots of cross reactivity and whatnot. So how is that different from mast cell? There's just a little bit of a difference. It's still the immune system, kind of an allergic attack, but how is it different?
Yeah, so our there's four arms of our immune system and that we measure frequently, and one is IgG, one is IgM, one is IgA, and one is IgE. And I'll just give you a brief tutorial on this because then we'll understand the allergic response. So IgG is our long-term antibodies. If we get the flu or we get RSV or we get some infection, our body first mounts one called IgM for 6 to 8 weeks, and that's like the acute antibodies to that infection. And then later we store that as a memory, like a photo of that virus or that infection as IgG. So these are our long-term antibodies. And if you've ever been like a mom that's pregnant and you're checking, are you immune to mumps and rubella? The doctor is checking your IgG levels to these old infections to see if you've had it in the past, see if your immune system has a photo of that virus and a memory of that virus. And again, that's real common. And then we have IgA. IgA is mucosal immunity. That's lining our sinuses, our gut, our lungs. And this is something that's protective against all those surfaces which are exterior, our interface with the environment. And so that protects us from sinus infections and lung infections like pneumonia and gut issues. And then there's this arm called IgE, and this is where allergies come in. IgE is the allergic eosinophilic arm. And when that gets triggered, typically your body thinks that that's like when you would take, say someone who's anaphylactic to peanuts, that IgE arm gets triggered, and that can trigger mast cells, but it can also trigger eosinophils or other types of allergic mediators. So it's more like the big picture is the IgE, and then a smaller part of that is mast cell and mast cell activation. And you could have an allergic, you could have atopic like dermatitis, which is eczema. You could have asthma. You could have any sort of allergies like allergic rhinitis. All of those are in the bucket of the atopy, but they may or may not involve mast cell activation disorder.
Correct. So if somebody suffers from that, though, because we hear about taking, antihistamines, right, or H2 blockers like Pepsid and things like that. So you mentioned both of those. The GI system is involved, and then the antihistamines involved. And so sometimes people will take antihistamines and mast cell and feel relief, and the H2 blockers, whatnot. So what's the association there? I have patients ask me this all the time. Should I be taking an antihistamine on a regular basis? I don't really have runny nose, but I have all the symptoms of it. So it's a common question they ask.
Yeah, so Dr. Afrin and Dr. Tanya Dempsey and a whole bunch of really smart people came up with this consensus 2 statement a couple years ago. It was published. So if anyone wants it, I can make sure you have it. If your listeners want to have the link to that article, it's this consensus 2 for mast cell activation syndrome. And what they determined is back to this old school idea of mastocytosis. We used to say the only way to diagnose mastocytosis was this elevation in tryptase in the blood. But what happened is there was a ton of people with mast cell activation disorders that didn't qualify because they didn't have elevated histamine or they didn't have elevated tryptase. So this new consensus says we need to have the symptoms consistent. And I mentioned a ton of those, and there's more in the paper. They really involve all systems. It has to involve more than one system, meaning heart, maybe heart tachycardia, maybe brain fog, and maybe skin disorder. So that's 3 systems. Because it just has one system, it's probably not mast cell disorder. So it has to involve more than one system. And then the last thing is it has to respond to treatment. So you have this clinical picture with more than one system that fits with mast cell, and then it responds to treatment. Now, treatment is what I want to talk about because that's what you brought up. So when we treat mast cell activation syndrome, it often requires a layered approach. And this is important because many people are like, oh, can I just take Benadryl? You can, but in my experience clinically, it's very rare that one medication or one supplement will completely control the symptoms. So often we have to layer those. And you mentioned a bunch of the common ones. One is H1 blockers like Benadryl, Claritin, Zyrtec, and Allegra. And then the second one is the H2 blockers like Pepsid or Zantac, which is now off the market, but those are an H2 blocker. Then we have mast cell stabilizers. Those can be things like Ketotifen or Cromolyn. And we have leukotriene inhibitors. That can be something like Montelukast. And all of those, and even steroids in some severe cases, can calm the immune system. I don't love steroids, but there's been people whose lives have been saved with steroids. And then there's lots of natural things. I love quercetin, luteolin. I love vitamin C. I love a Chinese skullcap, rhodiola. There's just lots and lots of herbs that you can use as well. And most of my patients have significant symptoms. They need multiple things to get control of those.
Absolutely. That's so true. And so I know, too, in the veterinary world, believe it or not, they use it. You can find it over the counter. You can find a quercetin and some other the things that you mentioned. But even for animals, they suffer a type of mast cell syndrome, too. So don't forget your dog may be having brain fog as well. But hard to pin down. But there are things that they can take. So with and I've kind of jumped all over the place, but I think it's more just to kind of pull together for people that, our bodies are incredibly complicated. We have such and I guess it was probably a speech I gave maybe about 2 or 3 years ago that, I feel like everybody in the next 10 to 15 years is going to have an autoimmune disorder of some sort. And again, I do believe very much in that toxic overload. The basis of everything that happens to us, almost everything, is inflammation. And inflammation, you have to go and find, as you said, the root cause of where, all of this is coming from. And sometimes it's multifactorial. It's not just one thing. But I do believe very much, as you say, the toxic burden plus the infectious burden, and sometimes the two, together. But something that I have trouble getting across to people and have trouble getting them to understand is gut. Gut is at the heart. And this is something that we as functional medicine doctors, we've known for such a long time, right? And just now GI doctors are starting to understand that, there's leaky gut. We have gut problems, and this is the heart of all evil. But we've known this for such a long time. But how does gut play a role in all of this, especially with the immune system? Not just mast cell activation, but for the immune system in general.
Yeah, so the gut is ground zero for so much of this, including autoimmunity. And the reason for that is this is our interface with the environment. Everything externally that we bring in for nutrition and nutrient consumption is from our external environment. So that interface is literally where the majority of our immune system lies. And that's because it's trying to protect us from toxins or infections or things that we consume through our diet or through, back in the day, the dirt that the child picked up the carrot and ate and maybe had microbes on it. But what can happen is that interface, if there is a breach in the barrier, creating more permeability, we're going to be dumping more antigens from food or bacterial coatings into the bloodstream. And that creates a terribly um, potent immune trigger. And so a lot of times this is where that starts to shift, where the immune system gets irritable and starts to overact. And we have this microbial mimicry where it starts to try to fight whatever's coming through into the bloodstream from the gut lumen. And then it gets confused and maybe innocent bystander like the thyroid or the joints get attacked. And that's really how autoimmune disease develops. Now, the other thing about mast cells is there's a lot of them lining the gut. So they are there kind of ready. We have these dendritic cells that are sampling everything that comes through into the bloodstream, and they are also more prone to be triggered by things like gluten or dairy or the coatings of gram-negative bacterial. It's called lipopolysaccharide or LPS, and all of these things are very potent immune triggers. So frequently, if there's a breach in the barrier of the gut, there is an increase in this mutant inflammatory component of the immune system, and then we have autoimmune develop or just inflammation in general. Now, it's interesting with mast cells because some of our bacteria in our gut are more prone to produce things like histamine. So there are certain probiotics or even good bacteria, if we have excess, that can be part of the problem. And if we have excessive bacteria or fungus in the small bowel, called SIBO or SIFO, those are all contributing factors to some of the mast cell activation and overload of histamine.
So true. Such a huge topic, right? I tell you, it would take us days to go through that.
Right.
I'll tell you, we're going to take a quick break and give a little time to sponsors for a moment. But I've always said, you may agree with this. This is my Texas. Personality coming out. But I always tell my parents, I'm like, get your child. Put them, get a dirty piece of chicken in their hand and a dirty puppy, stick them out in the backyard and let them make mud pies and let them taste them and eat them. And put them in daycare. Let them see all of the things they need to see, while young. And by kindergarten, they ought to be ironclad. They really should be in great shape. But we pick up the pacifier and use the Clorox wipe or the Lysol wipe and stick it back in their mouth, and we are really doing a lot to damage our gut and our immune system that way. So I hope that's a not so subtle way of telling my parents, let your child see the dirty things. We are going to take a short break, but I would love for people to know where they can find you, your book, information, all those things on you. Where's the best place to look?
Yeah, so my main site is just my name, jillcarnahan.com, and I have a book link there, lots of probably 2 decades of blogs, podcasts, everything you could want, all free resources on the website.
Yes, and I love that. So, and that will be linked on my website, so you can see our previous show plus on my previous for the last 3 years. I can't believe I've been doing this so long. So go to drpbetterlife.com, and you can find all the links to the podcast and her information as well. So we'll take a short break and come back on the other side and finish up. This has been a great talk. Thank you.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back, everybody. I'm Dr. Marianne Pinkston here with Dr. Jill Carnahan, who is giving us a gracious amount of time talking about mast cell activation syndrome. leaky gut, autoimmune disease, our immune system breakdown, everything. But there's something I think we left out that you are particularly fantastic at clinically, and that is mold. So, what does mold do to get in and join the play yard here with the mast cell activation syndrome?
Yeah, so many people, I mean, more and more people, thank goodness, on social media and blogs and are getting to know that mold is an issue. And I think as our quality of construction is becoming more quick, like buildings are being put up very fast, and some of the older buildings aren't maintained, and more buildings are being made of things that are porous, like basically of cardboard versus like stone or brick or something that's robust and resistant to mold. So we have all these factors, and then there's hurricanes and floods and fires and many, many more natural disasters that are affecting our climate and our housing and all that. So all these things are playing to create more indoor air quality issues. And so many people are living in a home that had a leak under the fridge or had a leak from the dishwasher or the bathtub overflowed or something where normal house maintenance, right? But if they didn't maintain it right and there was materials, the floorboard, the drywall, something that got saturated with liquid and was wet, then within 48 hours, if that wasn't dried off, it is likely to grow mold. And so many people have mold in their homes and they have no idea. All they know is they're getting more foggy. They wake up with joint pain. They are having weight gain. They have sluggish metabolism and on and on and on. And so mold is a really, really common thing. And it's relevant to our topic of mast cell activation because one of the most potent triggers of mast cell activation is mold. So say I have someone who comes into my clinic and they have all the symptoms, as I described, multi-symptom criteria for mast cell. They respond to the H1, H2 blockers. And then I say, okay, what's causing this? And we already determined infections, toxins are common. So I'll do some of those testings. But probably the most common thing that I find is there's a mold exposure. And you can test that through obviously environmental testing. There's things like a PCR of the dust. You can have an inspector do air samples. And the best is kind of a combination of things, or just a good history, knowing where there might have been water damage or intrusion, or an attic or a crawl space that wasn't sealed. So just knowing about the house and its history is probably the best way to start. And then you can do some testing. And then as a human, you can also test your urine for mycotoxins. And if those match the kinds of things you might find in the house, you have a pretty good case for an exposure. Now, I would caution a lot of practitioners and coaches are recommending urinary mycotoxin testing. I use it in my practice all the time. But just because someone has a high mycotoxin level does not necessarily mean their whole home is moldy. There's many other reasons like contaminated food or an old exposure, or just the way we're testing is it's excretion, which means they're getting rid of this toxin. So if someone's going through a detox, they might be excreting a higher level because they're detoxifying it from their body. So it's just a caveat that I feel like we shouldn't put too much weight on that urine mycotoxin test without knowing the whole story.
Absolutely. And this is the problem that people can order a lot of things online now. Again, they can go to ChatGPT and feel like they've learned everything about it. It's like you need to seek somebody who understands this, completely. And how many times do you hear though from patients, well, it can't be mold. I live in a new home. So it can't be it. And I'm like, but this is actually, and you stated that very clearly, this is actually something where you can have more exposure, especially in some place here like San Antonio. I hear that all the time. We have lots of new homes, and but mold is something that grows very easily here. You're humid and or used to be.
So here's some of the myths. Let's talk about that real quick because I'm in Colorado. It's a dry state. We have low humidity. Right now it's 18% here. Like that's crazy low, right? So people are like, oh, there's no mold in my house because it's so low humidity. Now, first of all, if you have a home, you need to keep your humidity less than 50%. Otherwise, you will have mold growth. So that's kind of a standard. I often, like I said, 20, 30, 40% is where I'm at in Colorado. But the Colorado crawl spaces are a big deal. If they're not sealed properly, there's moisture, there's mold growth under your house, and that communicates that air with your home. That's an issue. Same with the attic. And then the other thing that people think is, like you said, new homes. I would say the most common place that I'm finding mold exposures is in new homes because I can't tell you the number of times they put in a brand new kitchen and someone drilled the cabinets through a pipe and the pipe burst in the wall. No one knew about it. And all of a sudden, 3 years later, there's a massive mold issue in the kitchen. So there's these little things that you don't think about. And again, I hate to say this, but the truth is things are being constructed more quickly. There's less, I think the contractors might be good, but the workforce, I don't know what it is, but the quality is down from 50 years ago. of the construction.
Get it up. Let's go. Let's get it up and get it sold. And
Yeah, exactly. So there's a real problem even with new construction.
Absolutely. This is so true. So, well, this has absolutely been a wonderful, eye-opening. It's just skimming the surface. I think people need to understand that this is, I talked about kind of our break there. Let's not go down the wormhole too far, because we really can. And there's a lot of information. But where can people find more information that's reputable?
That's a great question. Well, I've made it my life's work to put out blogs and free information. I do have a book that's on the website called Unexpectedness, my own journey through mold-related illness and cancer and Crohn's. And a lot of the practical advice in there is just how to clean your house up from mold, how to heal yourself from mold. So that's a great resource. We also have a free mold guide on the website. Again, lots of free resources there at jillcarnahan.com.
Yes. And that will be on the website. Yes, that's why I asked that question, was to probably, because you have made it your life's work. You have a great story on your own health. If you feel comfortable enough, can give people an idea. We should have done this at the beginning, but give people an idea about how you came to do what you do as such a fantastic practitioner and so passionate.
Yeah, well, who would have known? I mean, all healers kind of often go through their own journey, and I guess I should have known it was coming, but I didn't expect it. I'm 25 years old, my third year of medical school. I was diagnosed with aggressive breast cancer. Suddenly and shockingly, I had to stop medical school to do a leave of absence for medical treatment. I had 3-drug chemotherapy. It's still today affected my immune system, so it's been permanent damage. Talk about mast cells and immune system. And then a year after I finished my treatment for cancer was considered in remission, I was diagnosed with Crohn's disease. And so then I battled that, and really I've completely reversed the Crohn's disease through my diet, my lifestyle, the functionalness, and all the gut stuff that we've talked about. And so I no longer have breast cancer or Crohn's, and it's now been over 20 years. So really happy about that. And then part of my journey involves when I moved to Boulder in 2010, several years later, there was a massive flood, and my office was contaminated with really bad toxic Stachybotrys, which is a black mold. I got very sick from mold, and I had to once again to figure out how to heal myself. And I kind of accidentally became a mold expert through that journey and experience.
Correct. Bless your heart. And that's the way of integrative and functional medicine doctors. We all have a story. There was a moment where we're practicing physicians, but then the light bulb goes on.
Right. Yeah, exactly.
So, well, I absolutely admire your passion. I admire all of your work. Obviously, it's always such a pleasure to have you on. I really appreciate it. I do want people to read your book. Unexpected is a fantastic book, so I do highly recommend it. It's going to be on the website again. I'll pull it right back to the top and have it up there. And so I hope everybody will check that out for sure. And your podcast and everything else, lots of great information. You're rivaling. I used to send people to Josh and Mark Hyman for everything, but look out, there's Jill Carnahan. So thank you for all that.
Thank you so much for your kind words. And I should mention too, the movie documentary we filmed around the same time as the book is now free streaming, so people can watch that for free as well. It's drpatientmovie.com.
Yes, please. I'm so glad you mentioned. I don't know how that skipped my mind. Thank you for mentioning that. I fully intended to. So it's wonderful, and it is wonderful too. So, well, great. Thank you again for coming on. Is there anything else we need to wrap up for Mast-A-S?
No, I would just say mast cell can be overwhelming. And I know some of these things, if you're out there, you're trying to navigate your own health and figure things out. And thank goodness there's so many resources. Just don't give up hope, because even this, as many systems that it affects, and as much as it affects your brain and things that are important, it's very treatable. So I really just want to leave with a message of hope that there is lots of resources out there to get well.
Perfect. I couldn't have said it better at all. Thank you. All right. Well, good. Well, everybody, I hope this was as fantastic as I feel it was. And Dr. Carnahan, thank you again very much. I hope to see you again. And I hope everybody has a fantastic week.